Good afternoon, and thank you for tuning in to the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macy Smith. Today's show is sponsored by MUSC Health Orangeburg. Joining us today from MUSC Health Orangeburg is Stephanie Harrison. Stephanie is the Director of Grants and Community Outreach. Welcome to the show today, Stephanie.
Thank you for having me.
It's a pleasure. Now, tell us a little bit about what it is that you do for the hospital.
Well, I oversee the grants department, the Tri-County Health Network, and community outreach. So we ensure that we are active in the community, providing various resources that the hospital has to offer.
Now, do you work collaboratively with Dr. Morgan? We had her on the show earlier.
Yes, we work directly together. She is the manager of the Tri-County Health Network, so we work very closely together.
So it's always nice to know that the hospital does expand their reach outside of the hospital walls, because folks are coming in from the community to the hospital, and what we know about this Tri-County area is that chronic illnesses do run rampant in our community. How much of that do you relate to health literacy?
Well, we we do our community health needs assessment, where we actually go out in the community. We involve the people who are in the community, and we address we assess for chronic illnesses, what is of concern health-wise to our community members, because we want to make sure that we have their voices and that we are addressing things that are prevalent and relevant to them. You know, we're not just going to sit here and say, you know, this, and this is what we're going to do. You know, we like to make sure that the community is involved, because health affects every area of your life. And we want to be making sure that we offer resources and support. So our division pretty much addresses that as we see the needs in the community.
It's great that you do that community assessment, because, as you say, you can't sit in your office and decide what people need, what information they need, and what resources they need, because what you're experiencing and what your family experiences could be something totally different than what the community experiences.
Exactly. And so our chronic diseases such as diabetes, obesity, hypertension are always very high on the list, and so we design programs around that. We offer health screenings, health clinics. We ensure that our physicians are connected, because we want to make sure there's access to health care.
That's right.
We also we do fun things too, you know, community Easter egg hunts, and we have food distribution. So we're out there saturating the community to make sure that we're involved. The hospital in and of itself can offer resources such as experts in these areas to help people to understand how they can, if they have already if they already have gotten these diseases, then you know, there's resources that you know, they can provide. But then we also work on the prevention side, healthy eating, active living. So we do things around that. Even Walk with the Doc is an activity that we have where there's access to care. You have access to the physician. He's out here walking with you and answering questions. So we make sure that we are connected to what the needs are in the community, so it can thrive.
Perfect. So we're going to take a break. When we come back, we want to learn a little bit more about the programs you are designing, or you have designed, to address those chronic illnesses. We'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. We're sitting here talking to Ms. Stephanie Harrison. She's a Director of Grants and Community Outreach. Stephanie, before we went to break, we were talking about just some of the programs that you all have designed as a result of your community assessment. Before we get to delve into the specifics of some of those programs, how often do you all do your community assessments?
Oh, it's done every 3 years.
Okay.
It is mandated by the Affordable Care Act.
Got you. Why 3 years?
That's how it's set up, every 3 years, because that's usually when you see transitions.
Okay.
The bigger, it's a good increment of time to measure.
Okay.
So that gives us time to implement interventions and assess the outcomes, and then by then we can go back and redirect if we need to.
Right.
So those are Yes.
So you're saying that many of the folks who live in the Tri-County area, they're dealing with diabetes, obesity, high blood pressure. What programs do you actually offer for the communities?
Well, earlier I mentioned Walk with a Doc, which is also addresses access to care, which is of great concern to us. We want to make sure that the community has access to the physicians. So that is where someone in the community can come and participate. We walk a mile with the physician.
So is it more than one physician or just one physician?
It's one physician per month. It's usually the first Saturday of each month.
Okay, first Saturday of each month. Is it at a designated location?
Here at the hospital on the track. And a physician is featured, and it's like a question and answer session. It's non-intimidating. You get exercise at the same time.
That's good.
All your
Y'all
questions.
trying to be sneaky, huh?
You get your questions answered, and you get to connect. We've had several people to become patients as a result of coming to Walk with the Doc. So
wow.
They've been able to connect with the physicians.
And get their medical care.
Yes.
Because of the space that you created for them to talk with the doctor and kind of avoid all the, I would say, just the confusion about the diagnosis or treatment. And also, you get a little tense when you're in the doctor's office.
Yes.
So that was a neat idea.
We've had some great physicians. Our endocrinologist has participated. Some of our orthopedic physicians. So just a variety have come out, primary care, to help us to make sure that we're educating the community about their concerns and answering their questions, and also making that key connection so they can receive further care as required.
Okay, well that sounds good.
Yes.
And you connect with the community in order to get that information out to the community to learn more about programs like Walk with the Doc.
Yes, we have a great marketing department that helps us get the word out. Social media is a great way to.
So we're going to take a break, and then I want the folks to be able to connect with you. I think it's a Facebook group that they can connect with. So in the event they don't get the information in their community, they can go to social media and get your upcoming events. We'll be right back. Welcome back to the Health and Wellness Hour. Thank you for sticking out with us. We're still here chatting with Ms. Stephanie Harrison about community outreach and community engagement. So, Stephanie, what do we have to look forward to in the Tri-County area? What's coming up?
We're having our Spring into Wellness Health Fair on April the 13th, and you can get information on Facebook about it. We're very excited. We're going to be collaborating with several entities that are healthcare related and or either connected in some way to healthcare. And we recently we had a grant with our mobile mammo unit.
Oh yeah, I see those around.
Yes, and so we'll have units out there like that, and that was very successful. We were able to take that out into the community.
In the rural communities,
yes,
at that,
and reach, screen several, preventative care, even some that were diagnosed were able to get additional treatment because of that grant.
Absolutely,
but we'll have services of that magnitude there, and we're just very excited to have everybody to come out on that day.
I love that. Early detection is so key in so many of the chronic illnesses. How can folks have access to that information? How can that information just be hands-on? Do you recommend them going to your Facebook page and be connected that way to learn what's coming up?
Orangeburg Health Fair, you can locate the information there that will give you more information, who's going to be there, all of that relevant information.
Well, thank you so much, Stephanie, for being with us today. And thank you so much for sharing great information about how MUSC Health Orangeburg is connected to the community and staying connected to the community.
Yes.
It's been a pleasure to have you today.
Thank you for having me.
Anytime. And thank you all so much for tuning in to the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. Until next time, it's the People Station.